Diseases of the pancreas are extremely difficult to detect early. In the case of pancreatic cancer, 7.8% of cases are discovered at stage 1. Nearly half of patients are already in the most advanced stage 4 by the time they are diagnosed. The key to early detection and protecting the pancreas is a procedure called endoscopic ultrasound, or EUS.
Today on the program, we're going to explore how endoscopic ultrasound, or EUS technology, is being used to protect the pancreas from early diagnosis to treatment. And we're going to take you to the forefront in Japan, where a groundbreaking approach to pancreatic treatment using EUS has been developed.
The pancreas is often called a silent organ because symptoms rarely appear in the early stages of disease. Its deep location inside the body also makes testing and treatment difficult. Let's see where it sits in the body using an anatomical model. Here we see the liver, stomach, and intestines. When the liver and the stomach are removed, part of the pancreas, hidden behind the stomach, finally comes into view. Behind the pancreas are the kidneys and the spine. The pancreas is surrounded by organs on all sides. Pancreatic exams usually begin with an abdominal ultrasound. Ultrasound waves are sent from outside the body, but because the pancreas lies deep inside, they have difficulty reaching it. This can make it hard to see the entire organ clearly. When necessary, doctors also perform CT or MRI scans. Even so, early detection remains challenging. That's where EUS comes in. It involves an endoscope equipped with ultrasound. Inserted through the mouth, it sends ultrasound waves to the pancreas from inside the body. This produces clear images that can reveal even small abnormalities. Itoi Takao leads one of the world's top teams using EUS for both diagnosis and treatment.
Thank you so much for your time.
You're welcome.
今日よろしくお願いします。
お願いします。
It's often said that pancreatic diseases, whether it be pancreatitis or particularly pancreatic cancer, are diagnosed too late. So what makes EUS so incredibly effective for early detection?
EUS は胃を通して十二指腸を通して近くの膵臓にできたものがよく見えます。2ミリとか3ミリこういった小さなものを見つけることができるんですね。これに対して例えば CT とか MRI とかこういった機械だとおそらく膵臓がんが例えば3ミリのものができてもこれはわからない。だいたい1センチから 1.5 センチぐらいになると、ようやく CT、MRI で、分かるということになります。明らかに小さなものを発見するという意味では超音波内視鏡 EUS が一番優れていると。これは CT とか MRI の比較試験が行われてますけども EUS の方が診断率が高いということが分かってます。
This is a CT image of a patient with pancreatic disease. The circled area is part of the pancreas. The scan shows no obvious abnormalities. Even specialists could not detect anything unusual. Let's take a look at the same patient's pancreas with EUS. Part of the pancreas is marked in white. Inside, a 6-millimeter tumor appears black. EUS captured this tiny tumor that did not show up on CT. CT and MRI are valuable for providing an overall view, showing how the pancreas relates to surrounding organs and blood vessels. Combined with EUS, they can help catch pancreatic disease at an early stage.
はい、じゃあ行きますか。超音波内視鏡。
This patient is suspected of having pancreatic cancer and requires a detailed examination with EUS. The EUS scope is about 1.2 meters long and 14 millimeters across. Like a standard endoscope, it has a camera and a light to illuminate the body's interior. At its tip is an ultrasound device, which is crucial for observing the pancreas. The scope is guided through the stomach and the duodenum to get as close as possible to the pancreas, where it emits ultrasound. Doctors observe the images from the device in real time.
これは膵臓ね。ちょっとここで曲がってるけどね。なんかあるわけじゃないね。ないでしょでも。はい。ね。
The patient was found not to have cancer, but the doctors decided on careful follow-up observation. The EUS scope can also be fitted with a needle. If EUS finds a tumor, doctors can insert the needle into it to collect cells for examination. The samples are then sent for detailed analysis to determine if they are cancerous.
I would imagine in the last decade, 2 decades, there's been huge advancements also in the technology itself.
まあ体をほぼほぼ傷つけることなく、そして膵臓をくまなく見ることができると。で、さらには必要に応じて細い針で組織を取ってくるという点に関しては、これに勝る検査法はないんではないかなというふうに思います。EUS は本当にパラダイムシフトだと思います。
The pancreas plays 2 vital roles closely tied to our diet. First, it produces a powerful digestive fluid called pancreatic juice. This fluid flows through the pancreatic duct into the duodenum, where it breaks down food. Second, it produces various hormones that regulate blood sugar and the secretion of digestive fluids. These hormones travel through the bloodstream to carry out their functions. In recent years, cases of acute and chronic pancreatitis, both marked by inflammation of the pancreas, as well as pancreatic cancer, have been increasing. One reason is dietary changes that put more strain on the organ. Pancreatic cancer in particular has increased nearly 8-fold over the past 40-plus years. The later the diagnosis, the lower the 5-year survival rate. A survey in Japan found that just 1.6% of patients diagnosed at stage 4 survive 5 years. Doctors worldwide are working to detect the disease as early as possible using EUS. Kato Yasuko is among those who have benefited from the procedure. In March 2025, she was diagnosed with stage 1 pancreatic cancer.
まさか自分はそんなね思わなかった。だって痛くもないし別にこう気持ち悪いわけでもないから全然気がつかなかった。じゃあ先生の方からこうだってお話があるっていうね、子供たちみんな来てねお話聞いて。
Kato had an MRI for another condition, which happened to reveal a suspicious change in her pancreas. She was referred for EUS to get a closer look. This is one of the images. The black, tube-like structure is the pancreatic duct. A closer look shows a slight narrowing in the circled area.
Clearly, いわゆる膵がんという、クリッとしたような種類としては認識はされなかったんですよね。ただやはり狭いところがあって、でそこの周りのところにどうしてもそういった悪い細胞がいるとちょっと炎症が起きるんですよ。
The doctors went on to examine her pancreatic juice and found she had stage 1 pancreatic cancer.
ありがたい。ありがたい。でも本当幸せだよ。こうやって見つかることは。
Kato underwent surgery in May 2025. Half of her pancreas was removed, and the cancer was completely taken out. She is now receiving oral anti-cancer drugs to prevent recurrence.
今はちょっと体力落ちてるけれども、まだこんだけ元気に喋れるし、弱っちゃったんじゃやっぱりね、うちの母親らしくないんでね、早く見つけて手術できてよかったと思ってます。
今子供たちにみんな囲まれて孫たちに囲まれてね、ばあちゃんって言われてね、嬉しい。生きてられるからこうなんだなと思って、お孫がまた生まれたりしてね、幸せを感じてね、また頑張りたい、楽しみたい。
Today, EUS is used not only for testing, but also increasingly for treating pancreatic disease. On this day, Itoi treated a patient with chronic pancreatitis. In chronic pancreatitis, long-term inflammation gradually hardens the pancreas and impairs its function. The disease is thought to increase the risk of pancreatic cancer more than tenfold. Proper treatment is essential. Chronic pancreatitis often causes narrowing or blockage in the pancreatic duct. This disrupts the flow of pancreatic juice, building up pressure in the duct and causing pain. Usually, doctors insert a stent at the duct's opening into the duodenum to drain the accumulated pancreatic juice and restore smooth flow. But in this patient's case, a large stone was blocking the duct near its exit. Itoi tried the usual approach, but it proved impossible. So instead, he decided to use EUS to insert the stent from the stomach, creating a new route to drain the pancreatic juice into it. The EUS scope was advanced into the stomach. The target was the pancreatic duct, located in the pancreas just behind the stomach.
これが膵臓の管ですね、これ。この辺から刺すのがいいね。
Itoi inserted a needle into the duct. Then, he widened the duct to make it easier to place the stent. For this treatment, he used a special stent he developed himself. It's straight at one end and curls like a pig's tail at the other. Until recently, doctors used a straight stent in conventional treatment. But organ movement could cause it to slip further into the duct. With the specially developed stent, the curled end stays firmly inside the stomach. This creates a stable passage between the pancreatic duct and the stomach, allowing pancreatic juice to drain and easing symptoms. The device is called the IT stent, after Itoi's initials. It has been in use in Japan since 2015 and is already adopted by many hospitals.
じゃないっすよ。うん。はい。バッチリだね。はい、ありがとうございます。
X-ray images also confirmed that the stent was securely in place. Without EUS, this patient would have needed open surgery. This greatly reduced strain on the patient.
I would imagine a huge amount of skill is involved as well.
しっかり勉強して、技術も習得しなければなかなか到達できないと、本当難しいんですね。EUS に関しては日本が診断も治療もかなり進んでいるというふうに思います。これを世界中に広げていって、どこの国の誰でもですねできるようなこのシステム作りですね、これがやはり日本にとってはこれから先ですね重要になってくるんだというふうに思ってます。
Hi.
Good to see
Can you
you.
hear me? Good to see you.
Very well.
Yeah. So,
Itoi and his team developed a new treatment for patients with advanced pancreatic cancer.
gastric artery obstruction of hot
It's called EUS-guided gastroenterostomy bypass, or EPAS.
You can see
At the request of doctors overseas, he often demonstrates the procedure live to teach the technique.
on and push slowly and get in and more the maximum pushing. Okay.
Fantastic, fantastic,
Thank you so
fantastic,
much.
fantastic.
In its advanced stages, pancreatic cancer often presses on the neighboring duodenum, causing it to narrow. This can make eating difficult. Treatment involves connecting the stomach to a part of the small intestine called the jejunum to create a new pathway for food so patients can eat again. Normally, this requires surgery, but that can be a major burden on patients undergoing chemotherapy and other treatments who are unable to eat properly. Itoi and his team have developed a treatment using EUS that achieves the same effect in about 15 minutes. They insert 2 balloons into the jejunum, inflate them, and fill the space between with water that has been dyed blue. The water shows up clearly on ultrasound, making it easier to confirm the location with EUS and carry out a safe procedure.
はい。 はい、次超音波内視鏡。この超音波で膨らんだ腸を見て、そして直接そのステントを入れていきます。
Itoi inserts the EUS scope into the stomach and observes the inflated jejunum to find the best spot to create the bypass.
ここね、ここ見える。ここがすごいいいかも。
Once the site is decided, an electric current is used to make openings in the stomach and the jejunum. The stent is then placed there.
Then最後ね、内視鏡で見ながら。もう見えたな。はい、見えたね。
He confirms with the camera that the stent is securely in place. Seeing the blue water that was in the jejunum confirms the bypass was created correctly.
いや、一番いいところにできたね。これは。これで食べれなかった患者さんが、もう明日から食べれるようになるね。
Being able to eat properly helps patients maintain their strength. That makes it easier to continue pancreatic cancer treatment. As of 2025, the EPAS procedure is offered only at Itoi's hospital. He is working to have it adopted widely in Japan and abroad as soon as possible. The American Society for Gastrointestinal Endoscopy's former president, Robert Hawes, was among the first to introduce EUS in the United States. He hopes Itoi's vision and technique will be shared with future generations.
The only way you expand a procedure and help more patients is to have more physicians doing a procedure. I'm always impressed because if you ask him a question, he answers it based on an inquisitive nature that he has. I think another aspect that I like is he's very interested in developing younger people, and younger people seem to really be attracted to him. He's got a great sense of humor. He enjoys life and enjoys people. I expect him to encourage younger people to continue along the pathway that he set forth.
私のポリシーとしてはですね、やはり患者さんを常に家族と思いなさいと、これも下の先生に言ってるんですけども、そうしたら自分の例えば親に EUS をやるということになれば早く上手にうまくならなくてはいけないと、そういう気持ちでやってれば乱暴なこの内視鏡操作もないですし、安全で確実な、そういった治療法を作ることもできますし、私はですね、膵臓に携わる研究者としてですね、まだまだ膵臓がん発見に関しては、十分じゃないと思ってます。日本中あるいは世界中同じクオリティで診断ができるようなシステム作り、これを目指したいと思っています。
It's such a powerful and such a moving message.
Lastly, Itoi explains the risk factors for pancreatic diseases, such as cancer and chronic pancreatitis. He says people with any of the following 7 factors should be cautious in their daily lives. Drinking alcohol daily for over 10 years. Liking fatty foods. Being obese. Lack of exercise. Smoking cigarettes. Stress from work or personal relationships. And diabetes.
I think probably for me, stress. And Professor, can I ask, how about you?
In terms of exercise, I have no time to do.
I'm sure you have no time, right? Because I think with alcohol, everybody thinks about the liver. Nobody thinks about the pancreas.
Exactly.
We all think about our liver.
アルコールはもう本当に万病のもとではあるんですけど、特に膵臓に関しては最もダメージを与える敵ですので、やはり節度を持った飲酒ですね。また食生活ですね。これ、どうしても脂っこいものとかですね、例えば大量に短時間で食べるということになりますと、これまた膵臓をかなり動かします。そうすると膵臓が毎日毎日それを行っていると、膵臓が疲弊してしまうんですね。そのあたりを十分気をつけるということが必要だと思います。
Many pancreatic diseases progress silently. Itoi says that if you notice any of the following 8 signs, you should see a doctor right away. Loss of appetite, weight loss, abdominal bloating, persistent indigestion or heartburn, pain in the upper abdomen or the back, diarrhea or whitish stools, jaundice, and worsening of diabetes.
Even if you have only one sign, please go to see a doctor. Probably there is some risk of such kind of pancreatic disease, so please go.
That's great advice.
Yeah.
I'll go and have it checked out.
Yeah.
So thank you so much.
Thank you.
先生どうもありがとうございました。
どうも。
I was deeply impressed by the remarkable advances in diagnosis and treatment using EUS and by the incredible dedication of the doctors leading this progress. And as we look ahead to even greater breakthroughs in treatments and research, I'm inspired to be more mindful of my own pancreatic health, and I hope you are too.